Colic is defined as a period of sustained crying on the part of an infant. This condition is exasperating to parents and often stressful to the physician trying to guide the young parent. The primary symptom of colic is crying for no apparent reason. The normal 1-month-old infant may cry for a mean of 2 hours a day. Crying that exceeds this amount is defined as colic. Characteristically, the crying occurs at a regular time each day, often at the dinner hour. The child cannot seem to be soothed or comforted over a sustained period. Some maneuvers of rocking and walking with the baby will calm him temporarily. The age range for colic is 4 to 8 weeks. This time period is altered by prematurity and occurs at 4 to 8 weeks from the estimated day of full-term delivery. The baby is often noted to turn red in the face, to draw up his legs, and to pass excessive amounts of flatus. These symptoms initiate the logical concern that there is something wrong with the child's gastrointestinal system. All of these signs may in fact be epiphenomenon that result from the excessive crying rather than the cause of it. On the physical examination, no abnormal findings are demonstrable. The child has usually gained weight appropriately as 0.5 to 1 ounce per day after an initial period of weight loss after birth. Often the baby has had excessive weight gain as parents very naturally respond to the crying by giving more feedings, and in fact overfeeding. It is important to go through the list of possible differential diagnoses, as colic is a diagnosis of exclusion once the child's examination is deemed normal and the other causes ruled out. No investigations need to be performed other than a complete history, physical examination, and assessment of the child's growth since delivery. A colic should not be diagnosed over the telephone, as there are several important mimics of colic that need to be ruled out. The only complications of colic are iatrogenic and come from unnecessary changes in the formula and stigmatization of a normal baby as being in some way abnormal or defective. These early impressions of the baby may take on a life of their own and be felt for years to come. The following conditions should be considered in making the diagnosis of colic: central nervous system infection, otitis media or otitis externa, corneal abrasion, acute glaucoma, thrush, hyperthyroidism, fractures, torsion testis, incarcerated hernia, bowel obstruction, urinary tract infection, hair tourniquet, diaper rash, rectal fissure, medications or immunization, maternal diet if child is breastfed. Virtually all of these diagnoses can be ruled out on the physical examination. The main forms of treatment are behavioral suggestions aimed at the parents. First, the parents need to be reassured by the pattern of normal growth and the normal physical examination. A review of the differential diagnoses that have been ruled out is also reassuring. For breastfeeding mothers, eliminate sources of caffeine and cow's milk from the mother's diet, particularly if you find excessive amounts of intake of coffee, cola or chocolate. Some mothers will note that certain spices seem to cross into breast milk and make their baby more uncomfortable. These too should be eliminated. Next, encourage the parents to avoid overfeeding and overstimulation. When the baby cries for no apparent reason, it is likely due to a need for sleep. After checking to be sure all their physical needs are met, it is important to place the baby in a safe environment and allow them to cry until they fall asleep. Baby will often wake up refreshed and happy. Keep the baby on an approximately every 2 to 3 hour feeding schedule. Crying 1 hour after feeding is not the cry of hunger. Parents may need to be refocused on supporting one another through this process, as fatigue and uncertainty may have them working at cross purposes. There is no place for pharmacological therapy in the treatment of colic. There is also no place for frequent formula changes, although these often have a temporary placebo effect. In very rare circumstances, a child may need to be hospitalized for colic if the parents have become overstressed and dysfunctional. Often relatives can assume the same role in giving parents some respite. Treatment aims to gain parental understanding, to decrease overfeeding, to decrease overstimulating, to break the cycle of crying.